Good morning, everybody. My name is Kathy Dennis, and I have been an RN for 22 years, and I work at a Dignity Hospital as a bedside nurse. I am a member of the California Nurses Association, National Nurses United, and I actually sit on the board of directors. We are gathered here today to spread awareness and provide education on the COVID-19 to our members, patients, and public. This virus is just the latest in a long string of infection diseases we have dealt with in recent years. And each time, CNA, NNU is forced to bring up the same concerns with our hospitals. Each time there is a new healthcare crisis, hospitals fail to implement the necessary protections. We want our hospitals to be proactive in times like these and not reactive. Nurses want all hospitals and healthcare facilities to follow the precautionary principle, which means we should not wait until we know for sure that something is harmful before we take action to protect people's health. What does this preparedness look like from the eyes of a bedside nurse? Implementing screening protocols to promptly identify patients with symptoms and travel or exposure history. We are happy to report that this week our hospital, Dignity Health, began this, and after we brought the concerns to them, they are now screening patients and family members at the hospital and encouraging them to go home if they are sick and not needing hospital care. Ensuring prompt isolation of patients with possible or suspected cases of COVID-19. These patients need to be placed in airborne infection isolation rooms whenever possible until COVID-19 is ruled out or the patient has recovered. We need to maintain our airborne infection isolation rooms. Recently, we had to build new airborne isolation rooms. We need to provide personal protective equipment to our healthcare workers, all our healthcare workers, not just nurses, who are providing care to those patients with possible COVID-19 infections. This personal protective equipment should include N95 respirators, plus eye covers, plus what we call the powered air purifying respirators, known to medical professionals as PAPRs, as well as gowns, gloves, and other protective equipment for droplet and aerosol precautions. This equipment needs to be easily accessible to nurses and not locked away in a manager's office. The hospital stocks supplies for what they need at the moment, so they are unprepared when a healthcare crisis occurs. Taking just-in-time approach may work for the automotive industry, but in the healthcare industry, this puts patients, nurses, and our communities at risk when an outbreak happens. Profits over patients has no place in healthcare. We know that our nurses can care for the potential surge of the COVID-19 patients, but we need our hospitals to be transparent and incorporate our input, the bedside nurse, into the preparedness plan, since we are the people on the front line at the bedside protecting ourselves, our patients, and our communities. As nurses, we are honored to have this responsibility to care for your loved ones. I would now like to introduce one of our ICU nurses, Jessie, to say a few words about what's going on in her area.
Hi, my name is Jessie Sonakoy. I'm an ICU RN at Mercy General Hospital. I've been an RN for over 11 years here at Mercy General Hospital. I'm proud to be a member of the California Nurses Association and a member of our Professional Practice Committee, which enables me to stand up and advocate for what's best for my patients. With COVID-19 present in our community, we must take this very seriously. Our healthcare system must develop a plan to combat the spread of COVID-19. One patient can have a huge impact on our system. For example, one patient at UC Davis led to the self-quarantine of 36 nurses and 88 healthcare workers. Their lack of readiness is creating an unsustainable healthcare staffing crisis. In fact, in times like these, we need the hospital to be increasing the number of staff, from housekeepers who keep our units clean and sanitized to the nurses who provide the care at bedside. We are hearing stories from our colleagues in the emergency department that they need additional staff to help with the increased screening protocols. We urge our hospital to increase staffing levels as a preventative measure on all units. In order for us to properly care for COVID-19 patients, we need hospitals to communicate with staff about their emergency response plan. We need hands-on education on our units so nurses can protect ourselves, our patients, and our families. Our hospitals have failed to provide the hands-on training. The posters and online learning are not enough. As for my unit, there have been no mandatory meetings regarding our plan for COVID-19 patients, despite being the designated unit to receive critically ill COVID-19 patients in our hospital. This is cause for concern. We do not want to be left with the shortage of nurses, and this is why we need more training and education. Nurses need personal protective equipment readily available on our units, not only so we can safely care for COVID-19 patients, but so we can safely care for tuberculosis patients. When PPE is not easily accessible to nurses in a time of emergency, a nurse is forced to make a decision. Do I care for my patient without the proper safety equipment and risk exposure, or do I go searching for the safety equipment, causing a delay in patient care, meaning life or death for my patient? Our ask is simple and reasonable. 1, hands-on education and training. 2, personal protective equipment readily available on all units for all staff. 3, increased staffing levels on all units. We want all healthcare workers and all in healthcare settings to have proper protections and training in order to protect the health of our communities. As nurses, we are here to advocate what is in the best interest for our patients and the public. We need the hospital to be transparent with staff, educate and train, provide us with the proper protective equipment, and increase staffing. Thank you.
What do we want?
Safety!
When do we want it?
Now!
What do we want?
Safety!
When do we want it?
Now!
What do we want?
Safety!
And when do we want it?
Now!